A newly qualified doctor from Leicester says the financial pressures he faced during his final year at university meant he had to take on a crippling work schedule. Declan Vardy is one of many young doctors who've had to take on extra work on top of their medical placement and studies to help fund their course. Campaigners are calling for more financial help.
Well, in the last 2 years of their training, the medics face a sharp drop in the amount they can get from student financing, leading to some dropping out of their course completely. It comes as the NHS faces significant staff shortages. Kevin Ashford has been hearing about the pressures on trainee doctors and also what's being done to help recruit more young people into medical professions.
The NHS needs more staff. The latest government figures show there are more than 10,000 doctor vacancies across the country. Declan Vardy from Leicester did a 6-year course to train as a doctor, but found that the financial pressures in his final year were so great that he had to take on a punishing schedule just to try to make ends meet.
I essentially had a job here in Leicester. So what I'd do is I would go on work placement throughout Monday to Friday, 9 to 5, and then I'd study late in the evenings and drive back on Friday to work 2 12-hour shifts on Saturday and Sunday, and drive back to my university on the Sunday night to essentially repeat the process over again.
For the first 4 years of their studies, trainee doctors can get student loans. In the 5th year, that changes to a combination of limited loans and an NHS bursary, which campaigners say means students have a maximum of £6,458 to live on. For many, that can mean a drop of up to 40% in their funding. Doctors' groups want students to be given what they're calling a livable NHS bursary.
I think it's something that would pay itself back. Realistically, if you have more doctors in the NHS system, because less are having to drop out before they even become a doctor, then you're not going to have to pay the extortionate rates that the NHS is spending on locum jobs. We need more staff, and although this could be seen to cost money, it will pay itself back so quickly.
The government says it reviews funding arrangements ahead of the start of each academic year to ensure they support students while delivering as much value as possible from taxpayers' money. While studying to be a doctor can be a financial challenge, getting onto a relevant course in the first place can also be a battle. 16-year-old Lexi wants to be a doctor in the NHS.
The main thing is the care for patients, the care and need to help people, as I always feel great satisfaction in helping others, and I feel like the only way in which I can make a positive change in society is just by working in the medical field, getting to know people, getting to help people.
Lexi's taking part in the Pathways to Medicine scheme run by the Sutton Trust charity, which over the last decade has helped more than 1,000 youngsters from less advantaged backgrounds get a career in medicine.
Without the programme, the students wouldn't have been able to access the work experience they need, been able to access undergraduate mentors who've helped them with their applications and to gain the confidence and experience to apply to medical school. The aspiration's there, the talent's there, but they need the support to be able to make those connections and move forward with their applications.
Similar pathway events are held in collaboration with universities across the country. This one is taking place at Imperial College, London.
It's a really good idea that the NHS reflects the people that it serves. I think that is fairer, but also I think it's really helpful for medicine. It's really helpful for people to have a connection to the NHS, and I think a diversity of doctors is a really good thing for healthcare.
Widening the intake of medical students can only help health service recruitment. However, concerns remain that more financial support is needed for many of those training to be our future doctors. Kevin Ashford, ITV News.